Distinguished Vice Minister of Health, of Public Health, distinguished representative of PAHO, ladies and gentlemen, I am very happy to be here in this neighboring country. I come from Colombia, but now I'm coming from Geneva, where we are working on the Partnership for Maternal, Newborn and Child Health. And we are working in the World Health Organization with over 600 stakeholders to see how can we work jointly in different programs and activities in order to achieve MDGs 4 and 5. And in this group we have governments, multilateral organizations, the civil society, the academia, health professionals, health practitioners, and the private sector. And this reflects what was discussed in the opening ceremony. Health requires many players, many stakeholders in order to implement it. We are also working with the Countdown 2015, which is going to be presented. Later on, we're going to present some of the studies. This has reflected that one of the responses to the initial question, which is why is it that some countries have made progress, more progress than others, in terms of reducing maternal and child mortality? Which are the reasons behind this? In some cases, they have the same economic power, they have similar policies, but which are the cases for this to happen? And this is where this study arises, which is a multi-sectorial sequence for progress, because we said we are going to look at the factors of the health sector, but also the factors of sectors that improve health and that are working not in an independent manner, but are working as other sectors. In that regard, Latin America has a lot to show in terms of the intersectoriality and some of the elements that were pointed out by the Vice Minister regarding social inclusion. We have 2 years left to reach the Millennium Development Goals, or to achieve the MDGs, and some progress has been made. And although we are aware of the number of deaths, of child and maternal deaths, the causes, the diseases, which are the different interventions, we do not know why is it that some countries are doing better than others. Some of them have very similar income levels. What was done in 2012 is that we looked at the data from the countdown, and we said that out of the 75 countries that have been working since 2005, there are 10 countries that have something in particular, have something special. We do not understand what is happening with them. These are countries that have reduced drastically child and maternal mortality, especially towards the year 2012. This doesn't mean that they continue dropping these rates, but these studies were trying to show what was happening back then. And what we decided to do was to take a closer look at the success factors of those studies, of what is happening in these countries. In some way, some of these charts began creating a movement of advocacy and awareness raising, showing that there are some countries that are doing good. As you can see, Peru is the only country in Latin America that is within this group, and Peru has shown a lot of interest. You know that the director of the World Health Organization visited Lima, Peru, a month ago, and also the regional director of PAHO. They wanted to learn, they were trying to learn what is being done here, how can we improve what is being done, and what is the perspective in the future. They were talking about plateaus and also reform processes to see how can we learn from what is happening here. And also the independent group of experts on accountability will also visit Peru in May of this year. So Peru is there like in a showcase. It's been showcased. They are implementing their programs, but what I'm trying to say here is that the global vision is looking at Peru as a country that has some elements from which we want to learn. Not so much to take the experience of Peru into China because they might not work there, but which are the elements that made a true difference here, a real difference here. So this is the purpose of the study, the analytical framework of the study. Well, the purpose is to look at the design in three elements. The first one is a health system with good functioning, which is known as a health system. I'm not going to read all the bullet points because I do not want to extend my presentation. The second one is to look at the public investment and policies outside the healthcare sector. And this is actually what we discussed this morning. We want to look at some of the dynamics and some of the investment made that have an impact in the health sector. And the third aspect is to look at cross-cutting factors or cross-sectional factors such as fertility, total fertility rate, inequalities, national governance, economic development, etc. This is the analytical framework. For this particular study, for the 75 countries, before selecting this 10, we identified 250 indicators related to the analytical framework based on the literature review and expert consultation, and we filled out very complex databases with data from over 20 years, and we conducted thorough studies that I am not going to dwell on right now. We did literary reviews, and once we and qualitative approaches, and once we identified the countries we were going to work with, we also began working with some of the researchers and some of the people working in this country. So this would not be a global study, but it should pinpoint some of the elements, and some of them are here. What are the differences in these countries that we call fast-track countries? They have some important characteristics. One of them is that there is a multi-sectoral progress to improve health determinants. And the first thing we notice is that the countries that have made progress in MDG 4 and 5, which have to do with maternal and child health, these countries have also made significant progress in the different MDGs, including education, poverty. These are some programs that are promoted in Peru, education, among others. These countries opted for optimizing strategies to maximize health outcomes. They focused on health and development, and they have the principles to guide policies and programs. And in this regard, the leadership of the government is quite evident. This looks at the way in which we see these models with information that was obtained both from countries and also global databases. And I'm not going to read the details, but this is for you to have an idea. Sanitation, fertility, GDP, scientific papers, women in parliament, schooling, skilled birth attendance. So as you see, this is a comprehensive analysis where the 10 fast-track countries have a higher score in most of these factors compared to the other of the countdown countries. The other 65 countries that we were for which we're doing a follow-up. This is what the status of the MDGs from 1 to 8 and the 10 countries that we have here. Here you can see Peru in position number 7, and you can see the progress made by these countries, not only in terms of MDGs 4 and 5, but also in the other MDGs. And this is something that had not been conceptualized before, because we focused on what is happening in MDG 4 and 5. So this is an interesting piece of information. You can see that there is something in both health policies and the general policy of the country that is working and that is leading to this situation. The Vice Minister talked about social inclusion and these other social policies that might have an effect on this type of results. So optimizing strategies to maximize health outcomes, specific policies and programs of these fast-track countries depended on their unique context and needs, but the evidence shows that these general strategies are important, and what we want to do in this meeting, as I mentioned before, is to discuss with you during our work, during group sessions, to make sure that this is also being done with the different groups and institutions, to see whether what we're learning is actually what we have here. Good governance is critical. The participation of women in parliaments in fast-track countries, in those countries that have a parliament. And here we see some examples that show the leadership to ensure profitability in Rwanda and Nepal. And I am not going to go into details, but this is for you to see how this is going to be reflected somewhat, which are the leadership factors to guarantee or ensure profitability in a country such as Peru. We have other examples. Working with 10 religious leaders in Egypt is something critical, because some of them had a fatwa, which is a religious statement or declaration, because Islam was originally against family planning, but they are no longer against family planning. These are the type of changes that we would like to reflect in this analysis at some point. It has nothing to do with what is happening in Peru. I know Egypt is a Muslim country, a completely different country from Peru, but this is just to show something that was done in that country, working in the private sector, with the private sector, and with a telecommunications company in Bangladesh. This was very important for maternal and child programs. And here we have something that came out from the original study, talking about poverty maps that were used to improve equality in the allocation of funds and delivery of services. It would be interesting to see in these discussions whether this was a key factor or not. But since we are reading a lot and listening a lot about programs for reducing poverty in this country, they might be relevant, and we have other examples in Ethiopia to use the evidence and information from information management systems, health information management systems used to promote accountability and encourage action. These are easy ways of looking at this data in a way that it helps decision makers to take action. Another innovative approach that were adopted is that these countries adapt, prove, and rapidly expand the service delivery models. For instance, innovative approaches based on the community in Nepal. Innovative community-based approaches in Nepal, and this was also mentioned here in Peru. Expansion focused not only on coverage, but also on quality. We also have other examples in Cambodia and Rwanda, when we talk about improving care provided during obstetric emergencies, and Rwanda looking at health workers and volunteers. So the 10 fast-track countries adapted the strategies to their own context, to their own challenges and strengths. So what worked here will not necessarily work there, but it did work here. So we need to see what can we learn from that. There is no one single recipe that will determine the exact mixture of investment that will work out. And since there are specific contexts and unique contexts, we need to look at those 10 countries and see what was the context and how come they were able to make more progress in meeting the MDG. There are also agile countries in effectively addressing the changing circumstances. To wrap up, I would like to say that the context matters. Context matters. How different can a country be within a region? And what we are seeing here in this particular case, we have the sub-Saharan Africa, the current reduction rate, which is in orange, of some of the countries. If we use averages from the same region, mortality, maternal mortality, child and maternal mortality, it cannot go up to the expected level, to what we want to have in terms of goals. What we need to look at is how can we have a better performance rate that is based on examples or some of the countries that have made better progress. Not only what a region can do as a region, but how can they get inspired from countries that have shown how to do this, that they know how to do this, and to continue working on this manner. This refers to speeding up progress can save lives, and it refers to the extent of the millions of deaths that would have been averted if countries would have met the goal. So on the first column, or in the second column, you can see the percentage of countries who should be on track to meeting the goal and the millions of deaths that would have been averted. And we are all trying to learn how to reach this point in terms of results. Policy implications, opportunities to work in a more integrated manner, both inside and outside the health sector. The government goals could help strengthen the bonds or links between sectors, and the specific objectives of each country could complement global goals, because the global goals are based on what is happening in the different countries. And one of the reasons why we are paying so much attention to this is because the Millennium Development Goals will end in 2015. Discussions are focused on how can we put health, and particularly women's health and children's health, within the social determinants. How can we include this? What can be the role of women and children on this? This has to do with the MDGs and also has to do with the health interventions. And during these discussions, this type of analysis that goes beyond a number of vertical interventions are critical. The Vice Minister said that he was talking to doctors and nurses, but now he is more involved with them, but also now he has to deal with mayors and community leaders. And I think these are elements that are becoming critical in the discussion of 2015 and after. I am not going to elaborate on this because this is part of an annex with further information. But to wrap up, I feel very proud as a Latin American citizen to be in this country, first of all, and also very proud because Peru is the only country in the region which has made so much progress and in some way is in a showcase so other countries can learn what was done here, how was it done here, which are some of the factors that are important, and this information should be part of the global discussions about the Millennium Development Goals after 2015. And on our side, at the WHO and at the partnership, we have a meeting at the end of June, beginning of July in Johannesburg, where the different stakeholders in these fields are going to attend. And we would like Peru to have a representative in that meeting so we can have a policy level discussion with the other ministers or the other representatives of the government so we can have this global debate and to see what can be learned in a practical manner. Especially, not only what was done, the point that was reached, but also that plateau and those bottlenecks. How is this country working to move this forward so Peru can continue being a country that is leading this area in the following years? I believe that the discussions in the next days will help us to achieve this. Thank you very much.